I'll just go back to the notes. So Wenda, I was just saying to the group, we have a bit of time actually. Sorry, I've got so many windows open. I'm just trying to keep everything organized here. So we have about 43 minutes to talk about these 3 questions. What are the top 5 things to do in the next 6 months as a citizen, as a public health professional, and as an organization? And so, Wenda, I was thinking, you know, since we don't have a formal Yukon Public Health Association, we could think about other organizations we're involved in and what we might be able to do. But I'm going to take some notes, and then we just need to make a slide to share back with the group when the discussion is done. So does anyone have any initial thoughts?
I had a comment about your lack of an association in the Yukon.
Mm-hmm.
If there aren't enough people to kind of warrant it, it wouldn't be the first time an association or a group has done like BC/Yukon.
Mm-hmm.
And so you could always sort of petition to PHABC to expand their membership to include the Yukon and have kind of like a Yukon chapter.
Yeah, definitely. We actually had some conversations about that. It's an option I'm looking at, mostly because I don't have the capacity on my own to set up a nonprofit society here. It's just a lot of paperwork, and, you know, the other issue that has come up for me is my role working for the territorial government and knowing that the role of an association is often advocacy. How do I avoid conflict of interest? And so ideally someone else would be the face of the organization. And I would just be behind the scenes doing the work.
I'm just wondering, Samantha, if we add to that, because I know the Northwest Territories of Nunavut also, I don't think, have public health chapters.
They do.
I'm not sure.
I think they're maybe a joint one.
Okay, because I was wondering, yeah, because they also could maybe join so that there's a stronger voice from the North with BC, so that, you know, that is, the numbers, of course, do make a difference. Especially in some of the national things that we may want to address.
Yeah. Whoops. Gosh, I can't type.
Speaking
today.
as a Northern voice always on BC-centric calls, it would be great to have more Northern voices on there.
Yeah. Well, and I was hoping that Sandra and Teresa and Margot would be in our group here. They were on the list, but they might just be taking a break. But it was so refreshing to have 3 people from Northern BC talk. And even in our public transportation or active transportation breakout room, you know, someone referred to Kelowna as like a small town. And I was like, oh, that's unfortunate. So certainly, you know, we face a lot of unique challenges, particularly in terms of resources that are often per capita based or population based. And we still need all the same supports, but we don't have as many people to sort of justify that more utilitarian approach to funding. So all really, you know, partnerships are really important for us. I think my local action as a professional. So I'm an epidemiologist and a veterinarian, and I'll be very curious to hear, you know, people who are on the front lines, kind of what you might see as action as a professional moving forward. But I think for me, it's really figuring out how to incorporate equity lens in my analysis and knowledge mobilization. And I would say equity and ecological. Because a lot of my work involves, generating the evidence that in theory guides decisions. So I'm less on sort of the front lines and more on advising policymakers and things like that. Does anyone else have anything to add about, local action or, top 5 things they might do as a professional in the next 6 months based on what we've heard today?
I think for me, it's been being more open to unconventional collaboration. And that was one of my takeaways professionally. So being able to collaborate alongside with, our local community forests, and to collaborate alongside with our fish hatchery and things that I wouldn't naturally have tied mental health to, but that could really be impactful in bringing mental health to that and public health to that.
And I was just thinking, it's Wenda, sorry, that it is not a topic that comes up quickly, environmental impact within discussions of different services. And so maybe as a professional, just to maybe engage in that conversation or bring it to the awareness of people, because it is not something I've heard of often. It might be, it's kind of a that person's thing, but it's not been done as an organizational approach, to these.
I think it's an opportune time for that. Last week, we had 4 days of the Houston Health Center being completely shut down, no urgent care, no nothing, no doctors, because we had flooding. And, these are some conversations that we can have because we have these things that are happening. Like, yes, we've had some water seepage in previous years, but we had 4 inches of water at our front desk. So this is an opportune time with some of the changes that are having to have some of these conversations and bringing awareness professionally amongst our interprofessional teams about some of the crises that are impacting mental health, physical health, emotional, spiritual, across the lens, like that. This is something that is going on now.
Yeah, so those intentional conversations, not just kind of have them come up haphazardly.
Yeah. Absolutely.
I think one of the things that we've been doing is, as a health authority, is particularly talking about co-emergency planning. So thinking about pandemic with the implications of wildfire, and now pandemic with the implications of flood, as we've seen all across the northern interior and now into the northwest and the northeast. So we've been doing a lot of that as an organization, but it's very much responsive. It's like that discussion from yesterday about preparation versus actual
prevention.
Prevention, there we go. I'm like, there was another key word and I can't think of it. So it's like preparedness or prevention. And we very much go to like, okay, well, we need to be prepared for when this happens, but it's like, okay, what are we actually doing to prevent any of those things? So like way further upstream, are we talking about what we're doing as a community and as the North, community of the North, to reduce our carbon footprint, or what that looks like. So yeah, I think certainly I feel like the locals, as a local citizen, like I've lived in different communities in the North over the years, and I always try to be very engaged locally and advocate for change locally. But like Teresa said too, I am always visible in the community as a Northern Health employee, so I have to kind of gauge how proactive I am in certain situations and kind of rein it in and be okay with incremental change, or like you were saying, Samantha, letting someone else be the face of something so that I can kind of take a step back. But I think there's no, it's time to stop apologizing and actually like, you know what, maybe we need more people with passion as the face of things versus like, oh, I don't need to get too involved, right? I think now is the time, if ever, to just be involved wherever we feel the passion takes us. So
Yeah, and I think that that's another kind of unique challenge to northern rural remote communities is I don't know about you guys where you're at, but um, I find here in the Yukon, it's often the same people taking on a lot. And so part of it is, you know, the whole people having their fingers in multiple pots, and part of it is a bit of the volunteer burnout we start to see, where people, you know, you have sort of the same people doing the work over and over, and it's something I've thought a lot about. You know, um, how do we spread that out? And I had a really interesting, so I do a lot of volunteering in the mountain bike community, and I had a really interesting meeting with, you know, the small road bike club that's starting to grow again, and the Cycling Association of Yukon, which used to be big and kind of went a bit defunct, but they focused more on competitive cycling. And anyways, we had this really amazing discussion about, you know, look at all the things we could do if we got together and broadened our mandate a bit, and instead of everybody doing their own insurance and their own waivers, how can we capitalize on having more people at the table so that more people get to benefit from the work and we're not all repeating work, and how do we inspire each other as well as share in some of that work, and expand the mandate to some more advocacy roles instead of just organizing events and things like that. So I wonder if coalition building is kind of a piece of that for the smaller northern towns and cities and communities. I might put that under citizen, but it could be professional or organizational as well. I don't know. What do you guys think? Maybe I'll leave it under citizen.
I think it's organizational as well, because coalition, like there is one here in the Yukon, right? The Yukon Anti-Poverty Coalition.
That's true.
Which has a number of people involved in it, and the work that they can get done, because different people could do different parts of it, is quite astounding at times. Yeah. So I think coalitions are great. It is a little bit harder to move forward because there's a lot of different opinions and stuff, but in the end, when those opinions do come together, they make a great impact.
Right. It's a good point, Linda.
For me, I think as a citizen, because I'm not so much engaged in the leadership, you know, of all these institutions. So now I think as a citizen, what I can do is to volunteer. Volunteer my time, you know, maybe join the group that are creating awareness or something like that. Yeah. So I believe that's one thing I could do.
I think one of the takeaways that I've got from all the chat boxes and all the different links and different, you know, journal articles and everything that's in reference, I think further educate myself as a local action as a citizen. I've got a lot of reading to do.
Yeah. That's a great point.
Yeah.
You guys hear me? I had to move locations.
Yeah. Hi, Rachel.
Hi. I was just going to say as well, bringing some of these ideas back to our teams, because when I first signed up, I was interested to see how this worked into our public health work. And I support nurses that are primary care nurses, so they're not just working in silos of public health, it's kind of everything. So just seeing how this kind of fits into our day-to-day work and where our communities are at. So supporting actually smaller communities, and seeing if where they're at with planning with interventions for, we've actually had a lot of flooding in our areas as of late, and how is that impacting our community? So just bringing it more to focus and awareness of people. So yeah.
Yeah, and I think frontline providers play such a key role in providing that, you know, all, like, you see all of the things that I wouldn't see sitting in an office, you know, and I think we need to push or, you know, encourage managers and directors to give their staff time to participate in these types of things. Because while primary care is obviously extremely important, you know the community, you know what's happening at the root of a lot of issues, and that insight, and you're often going to be, you're bringing that data, you know, whether it's quantitative or qualitative, back to the people who can communicate it up. And so all of that is really important to be able to make the time and space for those things to happen.
Another takeaway for local action as a citizen for me was just around all of the issues with food waste and being more mindful about the food that is being utilized and the plastics and stuff that are going into the garbage.
Another thing I would like to add is involving our children as well. You know, like we can build that kind of mind in them, you know, from the get-go. So they are aware of all these things we are talking about, not just we, but them to kind of intergenerational learning, you know, they learn as they grow. So by the time they grow, they know what all these things, because like me, you know, most of the things we're learning now is so new to me, you know, because nobody has ever said it to me or teach me, you know, or just make me to be aware, you know, of all this impact, you know, between humanity, food, animal, and all that. I think, you know, teaching them from early on, you know, that would be something, you know, we should keep in mind.
Where do you think that would fall, Adirondacke, like as a professional, as an organization?
Well, I would think as a citizen, you still
as a citizen.
Yeah, as a citizen. Those are the things you can do on individual or personal level, you know.
Basically educate the next generation.
I think even our social networks, like not just educating ourselves and our children, but also our partners and our family members, our people that are close to us.
Mm-hmm.
That's right. Yeah.
That also made me think, yesterday I Googled after somebody was talking about Canadian Coalition for Green Healthcare. And it made me wonder, like, hey, are any of our facilities across the entire North certified in this? Or, you know, what are we doing about food waste in our, you know, hospitals and long-term care facilities? Like, do they compost? Do they recycle properly? Like, yeah, so it made me curious about, as an organization, how could we bring that forward? And I would say I'm really pleased to see, like, Rachel, we've never met, but I'm pleased to see that you're on here from Chatwind. But like, there was so much that there was overlap with environmental health, where I was like, where are all the environmental health officers? You know, I saw my one friend who used to be in Northern Health, she's with First Nations Health Authority now, but that was it. And so, you know, we did have some medical health officers and whatnot attending, but I think environmental health has a lot of opportunity within the scope of their role and the ability for them to branch out a little bit. But a bit of a takeaway for me as a professional is to take some of this learning back as it's part of our education. Anyways, is how we're, you know, sharing this back with our teams, is to take this opportunity and some of the resources back to the environmental health team.
Yeah.
Which is interesting because they are a part of the public health portfolio, but then it's not really. So my role is I support more the teams on the ground, but I'm also regional, so I bring all the information back up to our organization, which is very lovely, but there isn't a lot of communication with environmental health officers. And I asked that these past couple of days, maybe there should be. So yeah, it's very, very interesting.
Well, and I think there's a bit of a historical piece to that. Like in my role in healthy settings, or what used to be called healthy communities, we used to work very closely with environmental health officers, but then over the last few years, there's been a shift in focus for them to prioritize like inspections and to get inspection rates up. And so they were sort of pulled back from the community piece, but then there's some really important pieces where someone was just mentioning, you know, when you're a part of a community, you bring that knowledge to your organization too. So being able to function in your role, but also being an engaged citizen, you know, you bring that additional knowledge. So it's been challenging where we've kind of become more siloed in the last couple of years from environmental health. But I think it's so much of an overlap, but we're very understaffed.
That was my other thing. They're covering large amount of communities for a very limited amount of people, which is unfortunate. So,
yeah. We have a really unique opportunity up here in the Yukon with the Yukon College recently becoming Yukon University. And I'm hopeful because I heard this at work this week too, about how, you know, environmental health officers are in such high demand, and, you know, we can't recruit up here. But I do wonder about how we take some of those needs identified on the ground and then say, like, help us build a program to train people here. This is much more health system focused than public health focused, but I don't know if any of you have had a chance to look at South Central Foundation in Alaska. They totally transformed their primary care system and do work much more upstream. They actually do a lot of more health promotion oriented work. But part of their big transformation was actually partnering with the universities in Alaska and creating their own training programs to have health professionals in the communities. So they created curriculum to train, I think they called them community health workers, behavioral health or mental health aides or workers, and dental aides or assistants, and they managed to change. I mean, this is over a few decades, but, you know, change the scope so that those individuals, they were coming out with bachelor's degrees. They were guaranteed jobs because the health authority essentially said, like, you know, we're paying for your education with the expectation you come work for us for a minimum amount of time. And then they managed to essentially legislate their scope to allow them to do more work in remote communities. And it's been wildly successful. And so I often think about, like, how do we get innovative in the North to meet some of those staffing needs, you know, that we rely so heavily on education from the South and people from the South, and what can we do that sort of meets our needs?
I think one topic that always comes up too is not just talking about staffing, is more retention, not so much recruitment, keeping the people here. I am not initially from the North, but did come up here for experience. So, but how do you keep people here in these smaller communities, right? So, yeah, just a question.
It's a great question. And I think a lot of the research has shown, like, money's not enough for people. It's actually more about meaningful work, autonomy, and it can be challenging in very small communities, I know, because if you're a healthcare professional, it's I think a lot harder to really fully integrate into communities. But even for people who are from those communities and work as healthcare professionals, it's like I know there's I think one vet in Iqaluit in Nunavut, and she's constantly called on day and night and expected to provide free services and all these, and it becomes, I think it becomes really challenging just as like a human and member of the community. So I don't know where the balance lies. Yeah.
Yeah,
That's a great question.
as an immigrant myself, maybe I can speak a little bit on that.
Yeah.
Yeah, because like I'm a nurse, from the UK, and I came to Canada. I discovered that it's a whole different system here, to get registered as a nurse in Canada. So kind of surprises me a little bit because like I worked in the Republic of Ireland, and then to get registration in the UK before I came here, wasn't that, there is a pathway for everyone. Like if you have the experience, you have the education, you don't have to go through the kind of rigorous system that Canada put up for foreigners. I don't know why they did that, but I just feel that very, very, ridiculous to me, because, I've been, to European countries that there's a system in place that if you're a foreigner, to kind of fast track the way you join the healthcare working system, there's a kind of way they do it. So you don't have to wait for longer, because the longer you wait, you are out of practice. That's, in my opinion, impacts on, even you feeling confident to go back to, practice. So I feel that unless something is really done, because I know a lot of foreigners, here in Canada that are professional, they want to join the healthcare workforce, but because of the, kind of barrier that has been put in place that nobody is talking about and nobody is even thinking about, like we still have a lot of shortage or retention of staff. Like where I am, if not that my husband has a kind of good job, of course, maybe I will have looked for somewhere else to go. But then, I just feel that something has to change, in that kind of, they have to rethink how can they, kind of orientate, people from outside in a faster way than the way they are doing now, because I don't think they're doing the best, from my own opinion. I don't know. Yeah.
No, that's a great point, and it probably applies to public health officers too, right?
Mm.
Environmental health officers, and yeah, so looking at innovative ways to
to integrate people into the working force. Yeah. I think they can learn from the UK, they can learn from Australia, some places, even here in US. Since I came, at least I have the licensing, the practicing license for the US. And I got that while I was in Canada. So like if today I decide to leave Canada, I will go to the US and work. So like, that's why I said I find it so ridiculous, the kind of system put in place in Canada. I don't, they have to learn from other people, I know.
Yeah, you're not the first person to say that.
And I don't know why, because and then it surprises me out as well, because people that even come from, like somebody came from, I think this Alberta. In fact, she trained here. She came from Alberta to BC. She trained here in Canada, but because her training wasn't in BC, and then because there was a gap, I think maybe she took some time off or something. So when she came to BC, she had to go for, I think they said, she said 18 months or something for training again before she can join the workforce again. Yeah. So I'm like, wow. So since she told me that, I stopped complaining, I just keep quiet, because I'm like, if I'm coming all the way from far, that, everything, the culture and everything is different, and you are here, you train here in Canada, they did that to you, then I should keep quiet, And I'm like, what's going on in Canada? What's happening? how is the Earth system so different from everywhere, in the whole planet? So that what is the special thing about it? I see every day. I just wake up. I ask myself that question, but I don't know. Somebody can give me the answer. I don't know. It's so ridiculous to me. Anyway.
I wish I had the answers.
Yeah. Anyway, it's okay. I know one day we will get the answer. I know. Somebody one day will think about the whole issue and try to make a change. Yeah.
Lots of work to do.
Yeah. That's right.
Does anyone else have anything to add? I think Sabrina came back. I don't know if Jackie or Christiana are here yet.
I wonder, like, one of the things that this has kind of brought up for me is thinking about the primary industries that we have in the North, and the fact that in order to have vibrant economies, we want people working, and a lot of the work revolves around climate change enhancing issues. And so I wonder, is there a collective or a place where there are ideas where we could share, the positive things? Like, we have passive houses in Fort St. John. We have windmills and whatnot out near Dawson Creek. And we've got, really cool hydro dams that are being built that, lessen some of the resource pull in other areas. But then ways that we can kind of showcase community initiatives that are doing well that can help motivate others. Because I think about working with local governments is my primary role, but if we show small successes, is there, I don't know, that's the thing, I'm not super well versed in climate change, particularly in northern BC. And so are there avenues to access where we could share information out or find out who's doing all this cool stuff?
You're muted, Samantha.
Sorry. I would just say I think that's a really great point, and I feel like we should have a northern table where we share ideas. And this came up in our active transportation breakout session, like, well, what about the places where it's winter 8 months of the year, and it's the suburban sprawl, everybody lives so far away or in rural communities, and it's really hard. And my first thought went to, like, well, people here, for better or for worse, whether they have to or not, like, they're so heavily reliant on fossil fuels, right? Like, they people love to snowmobile and drive their ATVs. I like to go in the boat. Like, we do end up driving a lot of places. But then I come back to, like, we can still do something. So then I guess the question becomes, what is that something? And maybe it's not perfect, and maybe it's not everything. And maybe we're still going to need, mines and some, resource extractive industries for jobs. But how do we really rethink all of that? And part of it, I think, is working with federal partners, because there are a lot of grants available that can be used fairly innovatively to promote things like renewable energy, different economies. and so, but yeah, absolutely. You know, I usually for environmental issues, I rarely look to the rest of Canada. I look to Scandinavia, because they have some of the best examples where these things have been successful. And I thought in our active transportation group, I thought, you know, they've figured out a way, and part of it is a cultural thing, I think. But they've created the culture where it's normal to bike everywhere on skinny tires 12 months a year. And they've just prioritized that type of transportation. And over the years, it's become normalized. And so maybe that doesn't work for rural communities in Yukon, but could work for Whitehorse, probably, if we aligned our priorities there. Yeah. So.
As we were talking about green spaces, I'm like, well, half the year it's not really green outside. So how does that impact people actually getting outside, which we know there's a reduction in people actually getting outside in those colder months, right? So, yeah.
So we have about 7.5 minutes left. I guess I have to start putting this stuff on a PowerPoint.
Yeah.
So stop that, share, open up the. Oh God, I have way too many windows open right now.
You're not alone.
Here we go. Now I will share my screen again. Okay, so what did we say? 3 to 5 main points. Sorry, now I'm trying to bring up my other notes.
I guess you can just copy, paste, and then delete irrelevant ones. That's what I did yesterday. Just copy, paste, and then delete the irrelevant ones.
Nice. Good advice. Oops.
Yeah. So.
Is everyone feeling inspired after the last couple of days?
Sort of.
It's overwhelming too, though.
Yes.
I left yesterday and I was like, oh, there were just so many big things. Like there's so much possibility for good, but then I have to go back and do my day-to-day work in addition to.
Yeah.
Oh.
I felt that I left yesterday feeling like my mind had been literally blown. I'm like, I don't think there's any more room for knowledge. I'm full.
Yeah. I'm for some trash TV.
Yeah. It's important, self-care.
Yeah.
Another point for local action as an organization would be for this just to be kind of the start of a conversation, and the possibility for like PHABC to be able to continue working groups or, you know, like opportunities for conversation continuing in this area.
Mm-hmm.
Yeah.
Yeah.
It's not just like this is the theme for this month and then on to the next theme.
Yep.
And sorry, go ahead.
Well, for us, we have a newer department in Northern Health called Health and Resource Development. So that consists of 2 full-time health resource officers, and then a regional manager for that program. And they do all of the environmental assessment approvals and work with Ministry of Environment for all the resource extraction projects that are kind of coming through. But one of the big pieces that has come to them is this climate change topic. It's like, oh, if this doesn't fall under environmental health and it doesn't fall under nursing and it must fall under you because you deal with resource extraction. And they're like, actually, we have our hands full with that.
Yeah.
But I think there's opportunity where they're actually kind of shifting. Two of their staff got into medical school this year, so they're like
nice.
Rehiring right now, and so there could be opportunity to expand. And I know one of the health authorities, I think it was Vancouver Island Health Authority, just got a grant to basically hire a climate change expert to support their development as a health authority. So I think either learning from what work they're doing, or sort of bringing someone on board who could look at it from a northern context and support our communities and support our organization internally and support resource, that might be a good fit in that newer department. So
that would be awesome. It would be great to hear more about that.
Mm-hmm. Yeah, and I think it really is about getting at those tables, right? Because to me, a lot of this stuff comes back to when you work upstream, there's so much opportunity to positively influence, environment, health of the environment, health of animals, health of people. And so I think a lot of it is just about being strategic and finding ways to get at those tables to say, like, have you thought about this? Some place, so Quebec has actually legislated a health and all policies approach. So anything that impacts health, the Minister of Health needs to be at least informed. And usually there are working groups and stuff where health people or public health people are at the table for planning. And so I think stuff like that can be, and then there are case studies from around the world, from Finland, from Australia. I can't remember where else, maybe Thailand. Anyways, I've really got to find that resource, but it's really interesting to see how other places have been able to implement a health and all policies approach.
We have it in a roundabout way in BC, where it's actually in the public health community charter, where any local government decisions that can impact health or are about health in particular, or health service access, they have to be brought to the medical health officer as well as to the Minister of Health.
Oh, interesting.
But sometimes things sneak through, and it's like, we don't necessarily do anything about it or push that agenda unless there's a bigger concern. So something comes up and you're like, wait a minute, this policy is going to impact health negatively. We need to address it. Sometimes things happen and we don't know about it until after. So,
right.
It's not necessarily like the province taking a stand. It's more that's sort of our backwards, like, we can now penalize you.
Hey, it works. Yeah. Yeah. Absolutely. Does anyone want to present this back to the group? No, no takers. All right. Looks like we're out of time. Thanks, everyone.
Thank you.
That's like the 1 minute countdown. Oh yeah, all breakout rooms will close in. Okay, so we have 1 minute. Yes, thanks everyone. That's been great. And I feel like we should stay in touch kind of after for some sort of northern group. I've often felt that we have more in common with northern BC even than the other territories in a lot of ways. So I don't know if others would agree, if Wenda or anyone else would agree with me, but
So Samantha, it's Margot here. I just I had to get called into something else and missed this conversation, but I would love it to have more conversations about some of these northern, rural, remote, Indigenous conversations. So
Yeah,
let's imagine that sometime in later in the summer or fall or something. I think
yeah, that would be great.
so it looks like you had a fabulous discussion, and I'll